A few people I've worked with recently have been stuck in either a left AIC or PEC pattern. So left AIC, left pelvis forward, PEC, both sides forward, and some things going on in the upper body. And both had worked or had tried doing PRI exercises previously, and they were having an inability to stay neutral, so their pain wasn't really going away. And what I found was there was a reason for that, and it was their feet. So I've done a number of videos about feet, but mostly in relation to having higher arches, which prevent your feet from pronating. Some people have the opposite problem. Their arches are so low that they can't really supinate. So every time you take a step, you should land with heel strike, which is supination. Then the arch should come down, which is pronation. And then you should re-supinate as you step through your big toe. So you have heel, arch, big toe, supination, pronation, re-supination. That needs to happen on both feet every step you take. Some people have arches that are so low, and not necessarily flat feet, I'm just saying really low arches. And because their arch is so low, they're essentially stuck in a pronated state. So they go pronation, no re-supination, pronation, no re-supination. It's just pronation, pronation, pronation. So what's happening with them is they're not getting heel strike and then pronation. They're just kind of landing in pronation and then somehow pushing through. Maybe they're pushing through their big toe, maybe they're not. We need to reestablish heel strike, but the problem is their arches are so low that they're just falling. They can't get that heel strike. So what I did was put paper towels underneath their arches, underneath the soles of their shoes, to kind of give them a higher arch. And their test cleared up immediately, and they felt better immediately. Like, it was pretty stunning. And that they were wearing decent shoes. Neither of them were wearing terrible footwear. But they're going to need something that with a little bit higher arch that forces them to get more heel strike. It's not necessarily support for their arch. I guess you could look at it like that. But what it's really doing is it's supinating their foot a little bit. So if they're like this and they're stuck pronated, the paper towel supinates their foot a little bit more, and at that point they can get more heel strike and they can make sense of their heels. So it can go heel, pronation, big toe, heel, pronation, big toe. So heel, arch, big toe. And again, we need that to happen on both sides. So if you have very low arches and you're having trouble with anything in life, any type of pain, your pelvis and upper body will have to compensate for that lack of heel strike by moving forward and then trying to figure out how to stabilize in that position. So in regards to the pelvis, the heel strike gets you left hamstring, and that left hamstring helps pull the pelvis back. And that alternating pulling the pelvis back, because you're getting heels on each time you walk, is what actually will keep you neutral.